welcome back to another fun episode of Thrive Live. Today, I'm excited that Dr. Rachaele Carver is back again for part 2 of the holistic dental approach to our body. Dr. Rachaele Carver graduated from UConn School of Dental Medicine in 2003 with her DMD, followed by a general practice residency in Milwaukee. And then following 3 years of private practice in Boston, she opened up her own practice in 2009 in the Berkshires. In 2011, after developing chronic eczema all over her hands, she disregarded the conventional medical path of steroids and immune altering therapies and vowed to cure her condition by healing her body from the inside out. In 2016, she received her health coaching certificate from the Institute of Integrative Nutrition and became a board-certified naturopathic and biologic dentist from the American College of Integrative Medicine and Dentistry. Dr. Carver is SMART certified to properly remove amalgam fillings and a certified ozone therapy practitioner. She uses energy medicine, homeopathy, PMF, and red light therapies to help prevent invasive dentistry. Thank you so much for coming on, and I'm excited to get into part 2.
All right. Well, definitely thanks for welcoming me back. There's always lots to share.
Yes. So as we were just discussing, let's start in kind of delving more into the connection between the meridian pathway. What is the meridian? Can't talk now. Meridian pathway for those who are not as familiar with it, and how it even correlates to the teeth.
Sure. So in Chinese medicine, we consider these energy pathways, which have been named meridians. There are 13 basic ones, and basically from the tip of our head to our little toes, we are all parts of our bodies are connected. And so interestingly, along with, say your heart is related to your uterus, your certain teeth are also related to different organs in the body too. So as Jen and I were just discussing right before we started, that most disease, if not 100% of disease, is really due to toxins and infections, which create stress on the autonomic nervous system. Autonomic nervous system is the part, we've got 2 branches of that, and the parasympathetic, that is the rest and digest, repair nervous system. And ideally, we were designed to spend about 80% of our time in that type of nervous system, right? We'd get afraid a predator would be coming at us. We'd get into fight or flight, but then immediately once the threat was gone, we'd get back into our parasympathetic. Unfortunately, excuse me, in our modern society, we spend probably 80%, if not more, in the sympathetic. And therefore, we're not having the ability to repair, to digest properly, to restore our body. And therefore, we have such an increase in chronic disease today. So, and there are so many chronic diseases today where typical conventional medical doctors aren't able to figure out what is the cause, because in our system today, it's, well, you have a symptom, I have a drug for that. And so nobody really, and we're not really trained in our conventional schooling, dentistry either, to understand what is the root of it. You have a cavity, okay, we drill it out. You have gum disease, okay, we give you some antiseptic things, we scrape your teeth and be done with it. Just come back every 3 months and we'll just keep managing disease. And to me, the whole idea of managing something was it just wasn't hitting it for me. It wasn't making me feel like I was really making a difference as a doctor. We go to school because we want to help people. Like, we believe in wellness, and so just limping people along with their disease just didn't sit right with me. So back to the meridians, we have, so every tooth lies on a particular meridian. And very important too, because the mouth is very closely related to the vagus nerve, which runs right down kind of near your carotid arteries on either side of your neck. And the vagus is that part of the parasympathetic. And there are actually 2 branches of the vagus, and that's another big topic. But anyway, we want to be more in the dorsal, the healing part. The other part of the vagus nerve is kind of the freeze response. So we kind of have fight, flight, and freeze. If you've ever seen an animal get scared and they'll freeze, that is part of the parasympathetic, but not the part that we want to help us repair. So anytime we have an infection, we talked about last time, if you have a root canal that may be, being reinfected, or an extraction site that never fully healed, all of those toxins are draining right down into the vagus and causing that autonomic nervous system to go awry. And therefore, that infection is a stress on the nervous system. And therefore, if we don't uncover that stress, we can take all the pills and supplements and therapies we want, but if we can't eradicate that initial stressor, we're never going to get 100% well. So when we think about, so for example, one of the things that I see most often in my practice is an upper first molar, and that is on the breast and the stomach meridian. And I have seen in my practice, since I've learned about this a couple of years ago, multiple cases of breast cancer and a problem with the tooth. So whether it was a root canal tooth that went bad, or an tooth that abscessed before it had a root canal. And again, and a lot of times the problem with an abscessed tooth, sometimes you have pain, but sometimes you don't. This is why it's important to have routine x-rays. Some people, especially those more of us who are holistically minded or aren't crazy about repeated radiation. Most dentists today, though, are moving towards digital x-rays, so very minimal radiation. But if we don't take these routines, we're missing these infections that have a dramatic impact on our autonomic nervous system and the rest of the body. So now it's really important to understand, just because you have an abscessed tooth, that doesn't mean you're going to get cancer. It's not necessarily a cause and effect. So I kind of describe it as, if you have an abscess and an infection up in your mouth, whether you feel it or not, if we imagine the immune system has 100 soldiers, if 60 of them are up in here trying to deal with this chronic infection, then you only have 40 left to deal with anything else all the way along that pathway. So from the tooth, all the way down to the little toe, if any aberrant cell happens, any inflammation, you don't have a full army to fight that, right? So by decreasing, and Dr. Jerry Tennant, he's a naturopath, he was an ophthalmologist in Texas, and he talks about teeth as circuit breakers. So if you have a dead tooth, whether it's a root canal or an abscessed tooth, that circuit breaker is turned down. So that's really how we get that problem. There's less energy in that circuit to deal with everything else that's happening on a daily basis. So when you have, let's say, it very interestingly, to people who have fibromyalgia or chronic fatigue, those diagnoses where we're not sure what's wrong with you, we're going to just throw you in that bucket. It's my belief that people who suffer from that, it's chronic infection, right? They've got toxins and infections, so their autonomic nervous system is just shot. And a lot of people might even be diagnosed with something we call dysautonomia. It's the same thing. Again, that autonomic nervous system is not working. The immune system does not work. So, and especially in somebody like that, look in the mouth. Are there root canals? Are there extraction sites that didn't heal properly? Are there abscesses that the patient doesn't know? Is the sinus, since I've been doing the 3D x-rays, it's amazing how much stuff that you can see in the sinuses. And unfortunately, a lot of times we send them to the ENT and they say, it's fine. Well, you're not supposed to have polyps and fluid and stuff in the sinus. It's not a normal thing. And a lot of times we think of, bacterial problems. So we take antibiotics for sinus issues, when most of the time it's actually fungal. Ear infections. Kids who get multiple ear infections, it may not be bacterial at all. It may be actually fungal infections. So you can take all the antibiotics you want. If they keep coming back and back and back, we need to look a little more closely. And that reminds me also, thinking about kids with chronic ear infections, that's really important that a dentist really takes a look at their airway. So the ear canal is very close, obviously, right, to the throat and to the mouth. And a lot of us, probably 99% of us, our jaws, because evolutionarily, we're not growing forward and down enough. So all of us are our faces are kind of smushed back towards the back of our head, which crowds our airway. And in kids, if they haven't, if they're not developing quickly, or, for whatever reason, if the airway is impinging and too close, anytime they swallow something, it may get trapped up into the ear canal. So if you have a child, a grandchild, somebody that has chronic ear infections, try to find either a functional orthodontist or a holistic dentist that might be, familiar with doing these airway approaches, and get the child. Is so exciting, because in a child, even as young as 1 year old, we have special devices that we can use that will encourage the proper growth. So from age 4 to 7, we have this amazing growth spurt. And if you can introduce these special devices, with sometimes tailoring the nutrition a little bit, we can make a huge, huge impact. And hopefully kids will never need braces. They'll never end up with sleep apnea, because we're growing the jaws to their full potential. In traditional ortho, we wait till all the baby teeth fall out, and then we try to shove the teeth into the jaw that they have. And every single one of those people ends up, as an adult with crowded teeth again, unless you had a really amazing orthodontist who really understood, all of the components. Most of those people come to me as adults and they want their teeth straightened again. The tongue also plays a very major factor into the way our teeth and our jaws come together. So if you have a backward swallowing, you have a tongue thrust. So a lot of people who have an open bite, where their top and the bottom don't overlap properly. I had a patient, she came to me and she said, I've had braces 3 times. And I just looked, just the way that she was talking, I could tell. I said, well, you have a tongue problem. You need to go to a myofunctional therapist. You need to train your tongue properly, and then you can have the braces, because the tongue just kept pushing against the teeth and opening. But they were straight, but she had an open bite. And even like she was struggled. She kind of had a head bob because all of the muscles, were very strained there. So a lot of important things to think about, but if you can get in while you're a child and still developing, you can avoid a ton of problems. And I really feel like if the airway is strong and stable, the tongue is going properly, and you're breathing through your nose. So nasal breathing is absolutely crucial. Speaking about the nervous system, every time you breathe through your nose, you stimulate the parasympathetic, resting, digesting nervous system. If you are a mouth breather, you're stimulating the sympathetic nervous system. So if you have a child and you notice when they're taking a nap that they're, with their mouth wide open, they're more likely to develop crowded jaws, crooked teeth, and a narrow airway. So, trying to close those lips. And again, there's a lot of cool little devices that even as young as 1 year old, we can help develop that nasal breathing.
That's pretty amazing. With I never even really thought about the difference of but it makes complete sense of the nasal breathing versus the mouth breathing.
Mm-hmm. Yeah, and we see that all the time with adults. The sleep apnea and the snoring there, and it's even more crucial as we get older, because after about 40, we stop making nitric oxide in the peripheral vessels anymore. And one of the major ways we get it is by nasal breathing, and the bacteria in the back of our nose create nitric oxide from the air that we breathe in. So if you're mouth breathing, this is why kind of it's like all of a sudden, we have all these chronic disease after 40. Well, if we never develop the proper airway, we're not breathing properly, if we're not getting enough oxygenation, that's why snoring and sleep apnea are such a risk factor for heart disease and diabetes and, you name it, all sorts of chronic issues.
Yep. Well, and I love kind of the underlying current of your talk. I love how it really goes back to diagnose the issue, right? Figure out the root. I feel like I'm working, especially this week with a lot of patients, of just changing the mindset of, we can palliate with natural medicine just as easy, with any type of medicine. It doesn't matter what type it is. We can palliate just as easily. And which sometimes there's definitely a time and place to palliate, but we need to keep asking the question, well, what's the root? Unintended with the talk.
Yes, exactly. And that's so important, and why so much of why we're having this conversation is to really help educate the public to think a little bit more about the mouth, because most dentists are not trained to think about this. Physicians certainly don't really get any oral, education. And I don't know, for whatever reason, we've kind of cut the head off the rest of the body, right? As if the same blood doesn't, penetrate through the whole body. So look, and again, I really believe you look for the toxins, look for the infections, and it's obviously easier said than done, because some things like parasites, they're hard to find, but I believe just about everybody has parasites, right? And then the other big factor is the emotional stress, the traumas. I mean, think of the last 2 years, if you can find any person who hasn't felt any of that stress, it doesn't matter what you believe, there is major stress, and seeing it so much in the kids, especially like teenagers, really, still trying to develop their brain. The brain doesn't fully form till like 26 years old. So any kind of stress in those first, 2.5 decades of life start to wire the brain in a certain pattern, right? And this is why, how come my 80-year-old patient with 6 root canals has no health problems, but my 25-year-old with 2 has chronic fatigue, right? So again, there's a lot of reasons for the differences, but it's really important to say that just because you have a root canal doesn't mean you're going to have a problem. It's all about the body, the person, right? So the people that we know who are, the happiest, maybe they eat the worst diet ever, but they don't seem to have any health issues. Their nervous system is balanced, their immune system is functioning at optimal. And so it doesn't matter how many pesticides they eat, their system works. So the energy is so flowing that they are able to, combat anything that comes their way. But I still believe, because our world is so toxic today, we have over 80,000 chemicals, that everybody, including kids, I think, need supplementation. We just can't get it.
We just live in a toxic world this day, and it's about kind of having some almost routine of detoxification.
I do. I think,
it's
you
going to
can't
be
just
different
do
for
it.
everyone, but
Right.
It's so important. I mean, it's just
doing
it
a
is what it
10-day
is.
detox. Yeah, that doesn't really cut it anymore,
No,
right?
it doesn't.
I believe people have to be on binders every time. I mean, both my kids, they take a binder in the morning, they take one at night. I'm just, because who knows what they're, getting into. So I think that's absolutely crucial. And then just been reading on the summit about the healing codes, which was kind of really, really exciting, that if we can rewire that nervous system, then we can really, we can conquer some of these issues even more easily. So even with dental, I've had a bunch of patients, again, thinking about the meridians and the teeth. There's also motions are tied to the meridians too. So for example, I think one people may be familiar with is the liver has a lot of resentment and anger. So maybe somebody in your life who's really fiery, really angry, all the time. And likely they have some liver inflammation, and that's related to canines, the pointy teeth in the mouth. So I think about that. I had a particular patient, and she had been going through a divorce, and she just kept feeling it. I was like, there's no reason that you should have any pain, anywhere here. And that's where I bring in like my homeopathics and like the ozone therapy, because ozone can reset the autonomic nervous system. Procaine is another anesthetic that I use a lot too. And even superficially injecting these absolutely 100% activates the autonomic nervous system and pushes it into the parasympathetic, so you can get healing. So even I've had a couple patients with, horrible pains that, persisted for months and months. They had steroids and surgery and you name it. They get one shot with the ozone and the procaine, which sometimes is called prolozone therapy, all better. And I've never needed, this is how I treat now temporomandibular joint disorders. I mean, you go to a lot of specialists and they want to put you in this splint and that splint, try to change your bite and this and that. And I can't say I've had one person not get better after one shot, because the ozone not only, unlike a steroid, which stops the inflammation, the ozone is actually going to the root of the inflammation. You're providing oxygen, you're resetting the autonomic nervous system, and ozone can actually regenerate cartilage. So it's just profound. You're getting at the root and solving the problem. So you get rid of the pain and the inflammation so it doesn't continue. So like some people who have migraines, right? They have to keep getting the Botox, every 3 months. So every 3 months you're injecting a toxin into your body, which isn't doing anything but stopping the symptom, right? It's managing the migraines, whereas something like ozone is actually getting at the problem, and you never need it again. One, there's no poison, so you're putting oxygen directly in the body, and it's healing the actual root of the problem. So that's what's exciting when you get into these natural medicine, when you really understand what's at the base of the issue there.
Yeah. Yep. Because when you understand the base and the root of the issue, you can address that, and then you can back down on all of our palliative therapies.
Exactly. It gets expensive, and if, I can't tell you how much money I've spent trying to heal my eczema with supplements and this tool and that doctor and this and that. And really understanding more about energy medicine and energy flow really started to shift my healing. And then when I finally got rid of my parasites once and for all, my eczema was gone. I got the right product, really understood what was happening. And once I removed that, everything my body was able to work again, because your body inherently knows how to heal. It is designed to be well, but there's so many obstacles and burdens and things in the way that it starts, every time you have a symptom, that's your body telling you, something's not right here. I need help. And that's what kind of took me on this whole route. When I was given this cancer drug for my eczema, I said, wait a minute. I said, my body is trying to tell me something, I just have to figure it out. That was my aha moment. And, it's been this great journey trying to really understand how the body works.
Yep. Yep. And I love the other point that you've been bringing up, because I'm always discussing this with patients and trying to get people to expand their vision of healing and what it really looks like in the body and how interrelated it is. Like you can't just look at the thyroid. Well, the thyroid is maybe not a good example maybe it's a perfect example, because so many therapeutics and the thyroid specifically go adjust. Okay, well, let's just palliate, bring the hormones in balance, when the thyroid is a sponge of so many other things and downstream from so many other things. But really, when it goes to healing the body, it's about the meridians, the teeth, the energetics, the emotions, the vagus nerve, the gut, the parasites, everything. And I'd actually, just as a side tangent, just be really interested to know, what do you see specifically in the dental realm with thyroid patients?
Well, when you think about thyroid, I think that's a tricky thing, right? Thyroid is it's tested so much because we have that test, right? And so many people are on thyroid medication, and maybe not necessarily, right? Because thyroid hormone, I think the other thing that people don't understand, because a lot of times when you get tested, right, you get conventionally anyway, they test your TSH and maybe for the antibodies, right? But what we're really interested in is the free T3, which is the actual active hormone, right? And there's a receptor on every single cell of our body, right, for thyroid hormone. If you don't have enough thyroid hormone, or it's not binding, then nothing works, right? You need that thyroid hormone in order to make the ATP, and for cellular energy, you have to have thyroid hormone. And a lot of people, their thyroid, for myself, example for me, my thyroid was working just fine, but I was not converting, this is a common problem, converting my T4 to T3. And so again, my thyroid's fine. I didn't need to be on thyroid medication. I needed to figure out what was preventing that conversion, which sometimes it's a deficiency in selenium, or not enough iodine, or gut dysbiosis, which I think was part of my problem. So any kind of gut inflammation can prevent that conversion, and any, issues in your liver. And I think that's the one thing that's very often mislooked. Actually, I had a patient today who said, she's having all these symptoms of liver dysfunction, but she said, well, but they told me my liver was fine. I said, yes, because they test for like 2 enzymes in your liver, and it has to be functioning at like less than 10% for anything to show up. But then I did a bioenergetic scan on her, and the number one thing that came up was liver dysfunction. So yeah. I said that's the problem with modern medicine. But I see, so many of my patients, are hypothyroid. That's the most common diagnosis that you see. But again, so for me, I'm always thinking, well, is it the thyroid? Is it a liver problem? Are you lacking in these minerals? Is it gut inflammation, which most of us have some degree of gut inflammation too. So again, it's, what is the actual problem? Is it really the thyroid? And a lot of times, just giving some of the natural free T3 hormone is really beneficial. And some people do really well on that. I had another patient, I've been working with her, and doctor put her on T4, and she said initially for a week I felt good, and then I felt horrible. I said, yeah. I said, send me the numbers. I said, have them rerun your T4 and T3. I said, see, it's your T3 that's low. So they should have put you on T3, not T4, because that's the active form of it. So
yeah,
to make a long answer longer.
Yeah.
that's a very complex, thyroid is very complex.
It is very complicated, because because I think it's affected by so much. And so it's almost like opening up Pandora's box.
Yep.
Yeah.
But interestingly, when my eczema went away and my liver was cleaned out, my thyroid hormone healed. Like I didn't have to take any medication. It just went. So that's my point. When you get at the root, by healing up my liver, now my liver had energy to be able to convert the T14, but it was so bogged down by parasites that it didn't have the energy to then take, do the thyroid. It was in, so we know like the mitochondria, right, which are the little energy producing organelles within our cells, they have two modes of action. One is defense and one is energy production. They're not like us super moms. They're not multitaskers, right? They can't do both. So if you have a parasitic infection, a virus, bacteria, that cell is trying to deal with that versus making energy. And when in school, we learn about the mitochondria just being about making energy. But, recently there's just been a lot of research how it's really, really important for immunity. Again, like people with chronic fatigue, they often have mitochondrial dysfunction. This is kind of a new hot topic, right? But the other day I looked up mitochondrial dysfunction on PubMed and there were 55,000 articles.
Wow.
So it's not really new, and that's the thing about research, right? It usually takes an average of, 10 to 20 years to get into the mainstream. And by that time it's already outdated. So, there's so much science behind what we talk about. And unfortunately, the modern medicine doesn't kind of keep up with the science, unfortunately.
Yeah. Yep. Agreed. I want to make sure we don't run out of time to talk about airway.
Okay. So as I was saying a little bit before, the kids, we can tell in a 2 and 3 year old when the jaws aren't developing properly. So what are the things we look for are the way the teeth overlap. So ideally your upper teeth should overlap your lower teeth, but only about 1 to 2 millimeters. So you'll see a lot of kids where the upper teeth completely overlap the bottom, and in adults too, right? If it never got corrected. So we call that a deep bite. And that is a big, big problem. If the baby teeth are already in a deep bite, the adult teeth, it's going to be even deeper. And when we have a deep bite, that makes the lower jaw farther back. So it constricts the airway, right? If a child, when they smile and you see a lot of gum tissue, we call that kind of a gummy smile. And that's another indication of the upper jaw not growing forward enough. The tongue is not sitting in the right position, because the tongue is actually really, really important for shaping our jaws and our airway. So the job of the tongue, it should sit flush on our palate. And everybody has right behind their front teeth, little kind of area of ridge. You can kind of feel the gum tissue feels a little ridge, kind of call that the spot. And the tip of your tongue should rest there with the majority of your tongue flat on the palate. The tongue is the strongest muscle in the body. So ideally that tongue should be resting on the palate, creating pressure, pushing out to the side. So it should create a shallow, wide palate. And by keeping the tip of it on right behind the front teeth, not on the teeth, but on the ridge area, that should help push it forward. But many, many of us have a tongue tie. So there's the little flap of tissue under the tongue. And usually at birth, they always check for this. But what they really check for is the one when the tip of the tongue, and that's very obvious. But we have other ones called posterior tongue ties that are back a little bit farther. So if you open your mouth wide, and if your tongue can reach the palate at least 50% or more, then you're good. But if that little tethered tissue, if you can't get more than 50% up, that's a tongue tie issue and it needs to be addressed. And nowadays we have lasers that the procedure takes about 30 seconds, heals. It's super easy and great way to do it. And a lot of kids, when we see these issues, we do what we call myofunctional therapy. So it's training of the tongue. And that is really, really important. Again, if the tongue is nice and strong, it's going to stay forward. As we get older and gravity comes, everything starts to loosen and collapse a little bit. And this is why it seems like, for me, I felt, oh, wow, I hit 40 and all of a sudden I'm snoring. What's that about? Nothing changed. My anatomy didn't change, but the soft tissue, gravity was pulling on it a little bit. So, but there are, again, some of the best exercises are humming, gargling. So these exercises kind of cause the muscles, right? We want to have good tone in the muscles in our airway. That also stimulates the vagus nerve. So not only are you creating good tone in your airway, you're stimulating that repair and mechanism in the body to help keep strong, healthy collagen there. And we nowadays, I have this phenomenal new laser, which I've been treating my sleep apnea patients with. Just using light therapy can stimulate that collagen to rejuvenate back to, let's say, when we were, 15 or whatever. So that's really, really exciting, because CPAP is still the gold standard for sleep apnea. But again, that is just a Band-Aid. We need oxygen, so that's forcing, and that can over time cause flaccidity of the tissue itself. And oftentimes you have to keep pumping it up. So although important, again, the root cause is the narrow airway, the collapsibility of the soft tissue. So, and a lot of people also may have a device that they wear that pulls the jaw forward, which again helps open the airway. So crucial to get air in there. However, when you're artificially pulling the joint forward over time, what is that doing to the muscles and the ligaments of the joint? So kind of worry about that long term there. Even in adults, we have great things that we can do to expand. We can expand. They used to tell us, oh, after age 12, forget it, you're done growing. I've expanded, people in their 50s. You can, they say up till 74. I don't know what's magic about 74, but so it's never too late to open up your airway, so that hopefully you don't need to have a CPAP. You don't have, people think snoring is common, so it's okay, but that's really a sign of dysfunction. And again, while we're sleeping, we're supposed to be repairing. So if we're not getting good oxygenation, we're not going to be able to repair to optimal levels. So again, there are a lot of dentists out there who we have learned how to create expansion with little device. And a lot of times it's relatively quick, 6 months or so to, 6 to 9 months maybe, to use these devices to not only widen, but bring the jaw forward and then balance that bite out there. So a lot of people who have wear on their front teeth, any kind of wear on your teeth is abnormal. So you should only wear about 1 millimeter every 100 years, which basically equates to no wear at all. So if you're noticing your teeth are getting shorter and wearing down, that's a dysfunction. Even if you have no pain and you don't feel like you're snoring, that is a symptom of, things not aligning properly and could lead to other issues down the way. So if you can get that airway open, you get the jaws wide, the teeth coming to the way they come, the way they should come together, you can avoid all dental issues. I really firmly believe that, because yes, the straighter the teeth are, the more oxygen we get, the healthier, even with cavities, right? We know cavities are really caused from inflammation. And if we are not getting enough oxygenation, that's another reason our body becomes acidic, and we get inflammation. So having that airway and making sure we have proper oxygenation is another way that we keep the mouth, free of decay, free of gum disease, and then the other issues.
I love it. It's a balanced, holistic approach to, not being overly aggressive in reinforcing our airway and structure, but, giving it focus as a pinpoint for really improving just how the rest of the body is working.
Exactly. Yeah. And a lot of times, if the jaw is out of alignment, then the whole spine and everything, I used to do these things we call occlusal equilibration, where we balance the bite. And, I'd get like 90% people. And I was like, 10%, what's going on with that 10% who doesn't get better? Well, those were the people that had major neck and shoulder, issues, the posture issues. So, thinking again, everything is connected. So if you can get all the muscles balanced, the whole body really benefits. And you'll see some people, especially kids nowadays, on the devices all the time with this forward head posture is really, really problematic. Yeah. So, and almost every kid I see today has some kind of crowding or those kind of issues. So again, if you can balance that out, especially when they're little, when it's a lot easier, because they're still growing, then you're gonna help their posture issues, which are so crucial for proper breathing too. That's the other thing. When we're hunched over all the time, we are crowding our diaphragm. We're not giving our diaphragm the space it needs to bring in the oxygen. And a lot of us just chest breathe, right? And if we're not doing good, deep diaphragmatic breathing, that's also affecting our health as well.
Yeah. Yep. So important.
Mm-hmm.
Well, I'm probably going to call it just from a time perspective.
Mhm.
And thank any other parting words for us?
I don't think so.
I have a question. Where do we find dentists like you? Unless we want to
So
fly out to
there are-
Massachusetts.
Yes, there are two organizations that have a lot of dentists who are trained like me. So one is called the IAOMT, so it's International Academy for Oral Medicine and Toxicology .org, and they have a Find a Dentist locator. And the other organization is IABDM, the International Academy for Biologic Dental Medicine. And .org, same thing, IABDM, and they also have a Find a Dentist. There's also the Holistic Dental Association, which may have one too, but those are the two major organizations. I've become accredited through both of them. And so, there's different levels of accreditation, different levels of education within that. So that's the thing about calling yourself a biologic dentist. There isn't, specific criteria. So because I also have the health coaching degree, I do a lot with nutrition and health coaching. Not all, biologic dentists will have that, but you can look and then, check their website and see what's nearby and what kind of things they specialize. Not everybody does everything. Unfortunately, I don't have a lot of practitioners nearby to rely on, so I've had to learn everything myself.
Yeah. Yep.
I think the ideal is if you find you have a good naturopath, you have a good, maybe a chiropractor if you need it, a good, and a dentist, like a team, because not one person is going to be able to solve all your issues. So it's nice to have a team approach. Yeah, that's important. And to say that too, the most important thing is the belief that you can heal. If you think somebody else or something is going to heal you, you'll never be well. And that's an important mindset to get yourself around. The body has the capability to heal. And if you believe that, you can heal.
I agree. Well, thank you so much for coming on. For those listening, if you want to find more information about Dr. Carver, you can go to carverfamilydentistry.com. And it was wonderful having you on today. So thank you again for coming. I hope that everyone has a wonderful weekend.
Yes, my pleasure.